Traditional research is very hierarchical, and I feel that everybody loses in a paradigm in which some people have all the power and the others don't.
No one knows their experiences better than someone going through them. And I think providing an opportunity for those doing that to have a say on research happening just means we're making better research.
Co-production is an approach in which researchers, practitioners and the public work together, sharing power and responsibility throughout the life of the project.
Participatory approaches really drive research impact, and they make research more meaningful to people with lived experience.
Academic research can be very confined into a sort of a plan. And this is being much more free-form.
You can research with people who actually have some insight and lived experience within a topic. And when they enter into that environment, that horizontal playing field, they're then able to voice themselves in a way that gives them proper control over their own experience.
Working together in a collaboration partnership, I can bring in my expertise, knowledge and see how they can be supported.
I was really keen to kind of be involved in the process, see the learnings for myself, the learnings from the research perspective, but also seeing the peer researchers as well grow.
What are the experiences of people living with HIV and working in HIV services during the COVID-19 epidemic in the UK? I really wanted to give complete control of the project to people with lived experience.
We worked together by recruiting a team of people living with HIV that could be researchers.
To develop people within the community living with HIV that they could do research themselves.
I found that my expertise, my involvement could be more value when I bring it to the table.
We approached Positively UK to collaborate on running a community involvement event.
It was really a great opportunity to be partnering with an academic institution that could give us the tool to carry on the research in a way that would bring results that were robust, so that we could provide better services, better support, and as well develop new skills within our communities.
From the beginning, I did some training, and that training gave me the skill and knowledge to be peer researcher.
We've learned so much in terms of how to support people living with HIV, building new connections, seeing our co-researchers really build confidence over time and hopefully go on to then produce their own research. The trust and the relationship that people have with their HIV service is incredibly important.
Sometimes there is this idea that peer research is not real research. You don't get robust data from peer research.
A large sense of challenges root in that because it's one, breaking down those narratives, breaking down those hierarchies to ensure that we are on an equal playing field, as well as rebuilding trust.
There was still a degree of uncertainty about whether you can trust this process.
So that's why building a relationship really early on is important. So before you've even set your research question, just getting to know people on a human level and not seeing them as participants in research, but actually researchers with you in the process.
I really hope that by doing more peer research we can actually show that the data that we produce is really valuable, it's credible and it can be used.
Once you get past that, once you begin to develop the relationships and show that that's not how research needs to be done, then I think things from there actually flow quite easily.
So we're going to be presenting findings back from 2 different studies. It's more of a process working with other people. So try to not see yourself as the lead of the research, but you're the person facilitating the process.
You can have research that is relevant to people and that it isn't something that perhaps just sits on the shelf.
Through this, I have been working with different culture background, and my fear is how this will be. But it was easier training, make the person who I interview to be calm and understand and be more open.
I've learned the research as well is also about community building, it's about knowing people, it's about connecting with others and not making assumptions.
Just informally hearing the peer researchers that we've worked with saying how they've now used their skills that they've learnt through this project, and now they're thinking about how they can share what they've learnt with others in the community as well. So hopefully it forms this sort of domino effect of sharing learning.
There was a lot of uncertainty and a lot of unknowns. People becoming aware of different information at different points in time. I would like to see more examples of good co-research, and hopefully also for our co-researchers to go on and train other future co-researchers.
If we can influence other people about how effective this sort of research is, then I think that will really make a difference to academic research.
We used to be people coming and actually do this research to us, and we are being interviewed. But being there and do it, you know, actually, okay, this is where it's going, and I'm going to get the result.
To be part of something that is important, to be part of something that can make a difference to other people so they don't have to experience the hardship that I have experienced. And I think that's what excites me about peer research.
I think that is the future of research, to be honest. If we're really going to make an impact and we're really going to make a change to the sort of health issues that we're facing, it's the way we need to do it in partnership with the people who are affected by these issues.